Hey, I'm Dr. Christy Gibson, and this is a series I'm doing called Hot Takes on Cool Topics. So this time I'm going to get into a more medical topic, and it's the use of berberine, which is an extract from the Barberry Bush, in the treatment of type 2 diabetes. What is the Barberry Bush? So it is a shrub, and the extract of the roots, the bark, and the berries all contain a potent chemical that's called berberine. And this has been used in traditional Chinese medicine throughout Asia for centuries. And what we're now proving, and it's showing up in the medical journals, is that this extract is useful in treating diabetes, cholesterol, and kind of metabolic syndrome, or the things that cause vascular disease, stroke, heart disease, that kind of thing. So pretty exciting. This paper, published in JAMA in March of 2025, is a study out of China on 113 patients who were given berberine, and it was shown to help them manage glycemic control, or their sugar range staying in the lower side. The patient group had moderate levels of diabetes, so their average hemoglobin A1C was 8.2. So that's like not very well controlled. And the both 500 milligram and 1000 milligram dose of berberine improved their glycemic control, improved their fasting glucose, so their sugar levels when they hadn't eaten for 8 hours, and improved their lipid profile and even any liver damage that was related to this metabolic process. This is a randomized placebo group trial. It's the best evidence that we can get in medicine. And it's super interesting because this has been known widely throughout Asia that this was a treatment, and it's been used in herbal applications, traditional applications, and the Western world has just kind of dismissed it because supposedly berberine has poor bioavailability, which means that it's not absorbed very well. But if that's the case, why does it work? The other thing that the medical community has claimed is that it has a lot of gastrointestinal side effects, which is interesting because so does metformin at the same doses. And of these 113 people, more than 93% completed the clinical trial. One described nausea, one described loose stools. So I would describe that as really well tolerated compared to the Western counterpart. And interestingly, also out of China, JAMA published an article in January 2026, and the study question was whether or not berberine helped with visceral adiposity, which means fat deposits in the mid-body, which is a risk factor for cardiovascular health as well. So what they measured as an endpoint was this visceral adiposity and also liver, like fatty liver, so liver steatosis. And this study did not have significant findings after 6 months, and it was a good randomized trial. But interestingly, they had these secondary outcomes that did improve. These secondary outcomes included lower levels of LDL cholesterol, lower level of apolipoprotein B, and lower level of high sensitivity CRP. So what do these three things mean? They are all measurements, like quantifiable measurements of cardiovascular risk. So risk of heart disease and stroke, kind of beyond just doing a cholesterol measurement. So LDL is the cholesterol, and the other two are more markers of inflammation. So what that's telling us is that berberine is reducing inflammation and thereby reducing one of the greatest quantifiable risk factors that we've been able to measure that could predict heart disease and stroke. So this plant that's been used in traditional Chinese medicine for centuries is probably one of the biggest new outcomes in clinical trials. Like there's not a lot out there that is natural medicine that has pretty low levels of side effect. Again, this clinical trial had very low side effects and is showing this kind of benefit. So this most recent study was done in folks who did not have diabetes. And interestingly, when it had been done in folks with diabetes, it did reduce visceral adiposity and fatty liver. So there's lots more information that needs to come out. The promise is huge and it's exciting. And as somebody who's studied tropical medicine and tropical disease, it's really giving artesunate. So back in decades ago, Chinese research was showing that artesunate was having phenomenal results when it came to the treatment of malaria, like 100%. And the Western scientists had never seen anything that treated malaria with 100% success. And so they just flat out didn't believe that this is what it was. And so artesunate was coming from the bark of a tree. So it was a natural substance. It was pretty easy to obtain. And they had these, remarkable results in their clinical trials. And it took decades for the Western scientists to finally believe that this was true, and for artesunate to become one of the most widely used treatments for malaria. And it just kind of goes to show you that like racism and xenophobia affect medical research, and that I was able to find a fairly recent debunking of berberine on a medical website in Canada. And they have not released a corollary statement saying, oops, but maybe they should. So this is not me promoting the use of berberine, and this is not clinical advice or medical advice, because you have to go over the risks and benefits with your own family doctor. It's more just a video to kind of demonstrate how something that has traditional and ancestral usage probably does have merit. And when we actually put these compounds into randomized clinical trials, they often do quite well. And so there'd been assumptions that this was something that was, a folk remedy, and people were taking it and it wasn't creating any benefit. And it was all along. So again, I don't know if this is right for you, but it's something to look into and consider. And I really hope that this kind of research continues, because the lack of hubris among the Western scientists when it comes to traditional folk remedies is shocking. There's things like essential oils that are proving to have antibacterial and other properties, and the things that we considered woo-woo medicine, lots of it is proving efficacious. And I just think that that's really exciting. And I'm hoping that people keep an open mind and stay humble and curious.